What is up, YouTube? Welcome to Teaching Trends and welcome to another Teach Yourself series. So today we're going to just talk quickly about billing, health insurance billing, and how to bill, how you can get a certificate for free, and taking this certificate online. It doesn't cost anything and all of that. Just good stuff. Welcome to everybody who is joining me back here at Teaching Trends. My name is Carla. For those of you who are joining me for the first time, welcome. It's nice having you here. That being said, everybody, let's get started. So we have health insurance billing procedures. There are different types of health insurance. We have government insurance, we have private insurance. Today, we're just going to get into how you process insurance. How do you process claims? What do you process claims on? So there are fees set for certain procedures. Every procedure has a certain fee. And once you find out what the procedure is and what the set fee is, that fee must go on a claim form known as a CMS 1500 form. That is the paper claim form. I'm going to show you what that looks like. So as you see here, this is a claim form, a CMS 1500 form. This is where all the insurance information is filled out. You see it is numbered here, 1, 2, 3. So there's different boxes on here, and each of these boxes must be filled out properly. There are 33 sections or 33 areas of the form, going all the way down to 31 here. So this is the information. I also have a guide put together on how to manually fill out this claim information. So as you saw, CMS stands for the Centers for Medicare and Medicaid Services. They're responsible for putting this claim form together that all insurers must use to process their claims. So as I did with this document, each individual box counts for what you should do and how you should fill it out. So this tells you how you should fill out box number 1 on the claim form, box number 2 on the claim form, all the way up to 33 that I showed you on the previous screen. So this just tells you manually how you would fill out the CMS 1500 claim form. Health claims are for reimbursement, meaning that money should be paid for services that the doctor provides. This should be accurate based on the appropriate amount. And there are ways you can find out about how much everything is. If you're processing claims, you are going to use a fee sheet or a fee schedule to determine what these amounts are. And we're not talking about that today, but we'll move on to health claims. So here is the claims process. You obtain the patient's information. The doctor actually takes care of the patient and diagnoses them, performs procedures. Then you record the payments and you prepare the health claim, and the insurer processes the claim. All of this information is done on that CMS 1500 form. So by law, claims must be transmitted electronically, which is why I make a lot of EHR and EMR videos. You can work as in records management, or you can work in claims and claims processing. There are a lot of jobs in claims processing, even entry-level billing, insurance, great jobs that you can work from home. These electronic claims have to be submitted through a secure computer and a secure server, which is great. This is called a direct transmission to a payer through an office through an EDI, an electronic data interchange. This EDI should be secure and private. If you want to know about security and privacy, I've also done a free course for HIPAA. Check it out up here. I'm going to put a little link there in the very beginning so you can see it up here on this transmission-based record. If you're looking to do this free HIPAA certificate, make sure you take it because you do need to know about privacy and security and sending records secure. So, not only do you have this course here for free claims and how to fill out electronic claims, you also have, in addition to that HIPAA course. Could also use what is called a clearinghouse. A clearinghouse is an organization that can update, modify, and correct some of those claims and send it back for updates and appeals and corrections. So, a clearinghouse will help clear that claim out. And in this course, you'll learn all about that. The idea is to generate a clean claim. That's what clearinghouses do. A clean claim is to make sure the address, phone number, and demographics are complete. If there's any Medicare special provisions you have to follow and guidelines, keeping that important information, spelling things right, having birth date right, policy number correct, all of those things need to be on your claim form for your claim to be processed in a clean manner. Remember, this claim form is used to process our claims and we go to the doctor so there could be payment paid for that claim. Again, those 33 sections. I will provide how to fill out the claim form in the description and in the comment section so that you could follow along and see how to fill out a claim form. Now we're going to go to the actual course where you could learn how to do this because now that claims are processed electronically, they are processed through the EDI, a secure computer, through EMR, and that information is sent directly to an insurance company for payment and processing. As you see here, this course is Medicare billing 837P and CMS 1500. So it is called the 837P process because that is the electronic process that the paper form takes. So whenever you hear 837P, just know that is the health claim form in its electronic form. So this course is going to walk you through that. It talks about the paper claim and the 837P electronic claim that I just talked about. This 837 process also comes with references. So if you're curious about what references can be used, this actually breaks everything down. Now, what is this? This form tells you what is on the hard copy form. So let's say section 17 on your hard copy form, which is where the name of the referring physician is missing information. The electronic loop will send this message back to you. So this is actually showing you the electronic error message you would get back if a certain portion of your paper claim was not filled out correctly. Keep in mind, our CMS 1500 claim form is now in the electronic form 837P. This tells you all about the paper claim and what you would do with a paper claim. There are different types of claims. This is the one for outpatient, going to the doctor, outpatient services. There are different claims for like hospital and facility, but this is one of the most common used one. If I do another video, I will do one on the claim form in hospital where you can get another free certificate to process these claims. So if you really want to take a course and you're interested in learning about claims and entry level, this is a really great course for you to get some basic knowledge about claims and really start looking for some jobs that are in this area. There are many entry-level jobs for this course. Now, as you see, entry-level claims, yes, there are auto claims, worker compensation claims, outpatient hospital claims. All of these claims are done on the CMS 1500 form. You might be processing claims. You might just be taking information for these claims, like your patient or your client information. As you see, a lot of entry level jobs in our workers' compensation, as I just mentioned, entry level insurance specialist, remote entry level claims representative. So there are a lot of organizations here where you can work Liberty Mutual Insurance. So there's a lot of different places here. Let's take a quick look at the salary before I add some information here. We even have one that has entry level and full training. Great job here. Depending on how much education you have, $20 an hour, $25 an hour, up to $30 an hour. I will make sure in the link in description, as I said, I will put this course down in there so that you can go take a look. If you want to know more about billing and claims jobs, check out right here. It actually shows you a lot of different jobs. Click on this thumbnail here.